evening from my heart and home to yours. It's 9:30 in Israel, and it is 2:30 in New York, and I am honored and thrilled to be sitting across from Matthew Rosett. Nachon? Rosett? Matthew and I we had a show years ago. I don't remember, but it was Michael Galinsky and Rose was with us. And I remember it was like in the beginning of my hosting days. And then I kind of lost touch with you. And then I realized you had this amazing, amazing Facebook page that you're admin, thousands of viewers and members, and really helping a lot of people with your expert advice. And you allowed me to come on and visit a little bit. And we got back in touch, and I said, it's time to have some quality healing in your space, in your holy heart centered space. I'm really thrilled. By the way, I learned so much from being in this roundtable. I'm humbled, really humbled. So enough about me. I'm Dr. Tova Goldfein. This is TMS Roundtable, and I am thrilled to introduce you. And I would love for you to share with the listeners a little bit about your TMS story, meeting Dr. Sarno, and then we can chat a little bit about heart-centered hypnotherapy, and a little bit about pain being your friend or foe. So thank you.
Sure. I like to talk and I like to tell stories, so I'll try to keep it relatively short. I had sciatica on and off for 28 years, along with a plethora of, the usual list: stomach, neck pain, back, but you name it, all of that stuff. And I read one of Dr. Sarno's books. I think it was Mind Body Prescription, but it is, because I still have it. It's all tattered and has notes in it. I found it the other day. And, I read the book, and at the time I was a paramedic. So I was, everything was physical. And I'm reading the book and going, boy, this guy is so full of it. And, the standard story, but then I'm reading the book and it's interesting me. So I'm going through that, and I'm lying on my back, just so you know. My pain is like a 7 on a scale of 10. I had just had an injection, a few weeks earlier. I knew I had a herniated disc, and I'm just like reading this and going, oh man, what is this? And then I noticed my pain was dropping off.
Unbelievable.
So I was just like, oh my, it was an aha moment for me. This guy is telling me something that clearly is doing something to my body. And my pain dropped probably about 3/4 down to about a 3 on a scale of 10, which I then put up with, because that was comfortable in my mind, for about a year, and it didn't get any better. So I called Dr. Sarno. He was in New York City. I was 15 minutes away in New Jersey. And he said, come in, I'll see you. And I was like, oh, that's cool. So I went in to see him, and you get this, for those of you who don't know, Dr. Sarno would do these amazing, it was 2 sessions actually, I think, but amazing length of time he spent, like 45 minutes on a history and physical. I mean, this guy really did it right. And when we were done, he was very convinced I had TMS, and he invited me to do his program, which I did and I went through his program, and most of my back pain resolved. And then a year later, 2005, I got up out of bed one morning and fell to the ground with vertigo. And I went to the doctor, and the doctor said it was benign, whatever. And then I called Dr. Sarno, because that's what he said, always call me. And I called him up, and he said, Matthew, you have more work to do. And he sent me to Bob Evans, who is a psychologist trained by him. And he's in Englewood, New Jersey. And that started a very transformational change. And one thing I'll add, because I know one of the big topics here is relapses, is I was doing very well with Dr. Evans. And 3 years into it, like 2008, I had the worst back pain episode I had ever had. Another MRI, I was on 7 10-milligram Percocets a day. And again, called Dr. Sarno. He said, send me your MRI. And I did. And he goes, it's the same as it was 4 years ago. You have more work to do.
Was this like an extinction burst, do you think? Like that's what they call it?
I would think so, yes. Yeah. I now know what created it, but at the time I didn't. And I went to my regular doctor who agreed with Dr. Sarno and sent me to a pain management guy just so we could get the pain down enough because he was concerned about me taking that much Percocet and he wanted to level it off and reduce the risk of addiction. And the pain management guy was fascinated by my story because I didn't want him to fix anything. I just wanted him to get me to a place where I could go talk to Dr. Evans twice a week. So it was an interesting,
Can I interrupt?
Sure.
Because I just want our listeners to get to understand. So what was the message of your pain to be that strong, and what deeper feeling was driving your body to be in threat mode and need to protect you? Was there
my belief was interesting at that time in 2008, that winter? I was training for senior level ski patroller. I had been a ski patroller for about 8 years. And the prior 2 years, I had taken the senior test as a recommendation by my instructor. He said, just take it. See, you'll pass some of it. You won't pass some of it. Then you know what work you have to do. And I had spent the last 2 years, the 07 and 08 ski seasons, training to get up to fix the pieces I needed to pass that test. And my back had started to hurt during that winter. And I kept blowing it off as, oh, we're lifting a lot of sleds. We're doing a lot of work. We're doing some very heavy skiing. We're doing, it's physically demanding work. And I was blowing it off and I wasn't listening. And the day I passed the test with my son, by the way, we passed it together. How awesome would that be, right?
Amazing.
My pain went from a 2 or something to about a 6 by that night. And the next day it was a 10. And I believe what we came up with was my passing that test, my joy with that, with my son particularly doing it together, was something I wasn't used to experiencing, the joy, and that I was actually really good at something. I was, there are only 25% of ski patrollers who attain the senior level certification. And I was just like, I was so good at this. I was really good. And that wasn't normal for me, being the best at something or being really good at something.
Interesting.
Yeah. Yeah. And joy is still a challenge for me.
Wow.
Having the time to go out and just be joyful. Yeah.
Thank you for sharing that. So it was like this interesting conflict in your brain.
Yeah. And it took me, like I said, that was the worst. I was on a fentanyl patch for about 5 or 6 months while I worked.
Thank God it was able to bring down the pain.
That and the fact that I didn't get addicted to it. I'm very lucky. Yeah.
So, because so many people take that kind of strong drugs and they're not responding because it's so psychological. So your body was creating the inflammation from neuroplastic pain, but it was responding. So go ahead. So you're in a lot of pain. You're with the pain center. It's TMS. You're kind of like getting relief physically from anti-inflammatory. So then what was going on with you and the TMS doctor?
Well, we did a lot of the emotional work. He also taught me about titration, which is a way to take some of the pain away and remove it to another part of your body that can manage it. Dr. Evans was way ahead of the curve. Stuff I learned from him in 05, 06, 07, 08, that time frame are things that people still talk about today. He worked with the inner child. He worked with attachment theory. He was a psychologist, analytically trained, but he went wherever, you needed. He was the one that said, try lots of stuff and take from each that which works for you and put it in your own unique toolbox, which I still teach.
I love it.
Each of us is different. We were discussing this earlier, you and I, where you have a certain skill set, I have a certain skill set. What lands on the client? What works for the client? So if we can offer them lots of opportunities, which we didn't have 20 years ago. We had Dr. Sarno's work 20 years ago. Now it's expanded into Dr. Schechter's work and Dr. Schubger's work and Dr. Clark's work and Dr. Gabor-Mate. And, the list is Dr. David Hanscom. We've got all these amazing physicians now going, the emotional and the spiritual part of you is just as important as the physical. So we're looking at us more holistically. Which is
Wow.
a beautiful thing. We need more doctors like that.
Wow. I love hearing you speak. You have such a great hold on this work. I'm just really, thank you so much. So I love the titrating. I might not, that's a great, can you share that? Because that might be something new. Because in other words, is it the same thing as, let me just see, is it the same thing as, like, notice that there's pleasure, because like this is part of the PRT, like notice there are other parts of your body that you're not in pain. Is that what you're talking about?
Right. The way he described it to me was, think about taking a dropper of red food coloring and putting it in a shot glass that's 1 ounce. And you put that one drop in and it turns completely red, right? Well, what if I put that same drop in a swimming pool? It would disperse. You wouldn't even see it. So the point was to use parts of my body that were healthy and happy and doing well, and try to take some of that pain out and move it into an area that it would disperse. So the purpose of that is really symptomatic, not getting to the root cause. That's a intermediary, which we see a lot. We get people, and this happens all the time, people do their work, they get rid of their symptoms, then they get comfy and they stop doing their work. And then it's building, building, building. They don't realize it. They crash and burn. Then they come on the website and they go, help me. And I'm like, you're going to need some drugs, lady. You're going to need something to take the edge off. And again, I'm not promoting that. That's between any person and their physician, whether they use medication and what medication. But you're going to need to take the edge off enough so that you can go, okay, I'm thinking clearly enough now. Oh, what is underneath this? Where can I go? So right. Understand that the titration is more of a symptomatic treatment to help me get to. Right.
But there are people, the challenges, I think, for us is there are some individuals who the pain is so great and their relationship with it is they're so focused on it that it's even more exaggerated, like hypervigilant is that word. Like there's this huge sensitivity and focus. So there's a whole emphasis. And for them, I would love to find something that would calm the sensations down or dial it down. But what you're saying is that, but titrating is emotional, it's psychological.
Yes, and there's other ways to do it also. Another way to do it is you can do a hypno session with someone and help them create a dial or a slider where they can go from 10 to 1 and physically drop their pain down. So that's
we should talk about that. Let's talk about it like a little bit about how you would do that. And then you add the heart-centered, which is just a perfect coupling of love and compassion, to calm down the fear. So can you share about that? Because this is the first time we've had a heart-centered hypnotherapist in my virtual studio. And so I'm in awe.
Well, thank you. First of all is to understand that I use hypnotherapy in 2 ways. I use the hypnosis typically to help someone drop down, get calmer. And that way they can go back in time to the first time they had the pain, or symptom, which will take them back typically to, somewhere between 1 and 7, sometimes in the womb. And then they can get to that part that's creating the pain, and then they can help solve it. The other way hypnosis can be used is with a titration process, where you can do a hypno session with a client and understand that the hypnosis I was taught is not the stage hypnosis where people bark like dogs, and that people that do that want to do that. It's not that the hypnotist made them do that. They wanted to do that. I was always trained, my clients are always conscious of what's going on around them. So they always have a choice to stop, and they're leading the show. I'm just holding space for them. So that's an important part. So another piece of the hypnosis is you can do a titration exercise where you have people visualize the pain, and then visualize a dial, either to turn down or a slider like you would use on a dimmer switch, and then practice bringing that dimmer switch down, and then have them remember that and take that out of the session so they can practice at other times. Because if you can't get your pain down to a place where you can think, where you can emote, right? Because that's the purpose of the pain, is a distraction, right? The pain is protecting us though as well. So there's that ability to titrate, and the hypnosis also is very good. It's not curative. Hypnosis is not curative, but it's a really cool tool to help us get to the part of us that is in pain. Because when we can get to that little kid, we can help he or she learn what is going on for her and help her heal.
Wow. I love it. More, a little bit more about that.
Interesting. From the heart-centered hypnotherapy perspective, we go back in time to the first time you had this experience. Let's say we find a child that is, sitting alone in a room waiting for mom to show up. Child's at 5 years old and they're at kindergarten and all the other kids went home and mom's not there. Well, what's going on for you? Well, maybe the child is terrified, frightened. Where's mom? I'm alone. I'm abandoned. So if you have those belief systems, I'm alone, I'm abandoned, I'm not loved, whatever it is, not worthy, that's a classic one. You're then at 5 years old going to go, well, how do I fix that? And you're using a 5-year-old brain. So the 5-year-old's going, well, I'll be perfect and good, or I'll be very quiet, or whatever. They create a thought pattern for a behavior that supports their belief system. But remember, their belief system is that of a 5-year-old. Now, mom rushes in, sorry, honey, there was a delay in traffic, let's go home. Now, if the parent had just taken a moment to go, how are you feeling? What's going on for you? We could have solved it right there.
Yeah.
So the child has gone into shock, into fight or flight. The child has buried their emotions, and they have done a survival technique. They have created a behavior to support what their belief system is. So the key with the hypno is to get back there. Now you go back with resources, okay? You go back there with your divinity, spirituality, whatever that is. You go back with your strong, wise adult. We all have a strong, wise adult, or self-energy. All the spiritual traditions talk about that. We may go back with a relative, in our mind that has been a mentor to us. So when we go back to that place, now we have all this help to help that little person go, okay, what really happened here? Well, it turns out mom was stuck in traffic. In this case, anyway. You have to see what the child's perception is and help them come up with a new belief about themselves and a new behavior. And then you write that stuff down and you take it out of the session, and that's the work you have to practice.
Wow. So I'm going to give you an example because, lately I've met some people who are struggling with post-COVID, long COVID, or I've been able to help a client who was terrified to get the COVID vaccine and he got it and then he had enormous symptoms, but he's been responding. Like I'm just, there are people who are struggling with medically unexplained symptoms, autoimmune, and they're adults and their body will just start attacking itself and the immune system and nervous system become, so this particular person lost his taste.
Mm-hmm.
And then it came back, and then he had some trauma with his marriage, and he now has like an entire array of burning tongue, taste, and like in terrible fear. And I like to apply the same, like nobody's the same, and it walks into our office.
Mm-hmm.
But part of it is his body is living in a state of threat, and the tongue is the organ of attention. And so there's all this energy around eating and drinking and, and so part of it would be not to go back to his, childhood, but more so having this relationship with his body So how would you use the hypnotherapy to help the relationship? Because he probably hates his body, and you can't heal the body you hate.
And that is the key with the hypnosis is I do not have any intention of getting anywhere. I take the client and they pick a symptom. Let's say it's the burning tongue. We're going to focus on that and regress them back to wherever they go. I don't define that. They don't even define that. You'd be surprised sometimes where a symptom will take you, because inside, Bessel van der Kolk, the body knows the score, right? The body knows. So if we can drop down into hypnosis, a trance state, which is kind of between waking and sleeping, that place where we go just before we fall asleep and just as we wake up, there's more of the thinking brain is offline. So we have more of an opportunity to get to our subconscious.
Beautiful.
And when you regress that person back, I will promise you, they will go back to somewhere between 1 and 7, or they'll go back to the womb. Some people go back to prior lives. Not everybody believes in that, but that's okay. And they will find they had an experience. And that experience, now let's slip into internal family systems a little. What Dick Schwartz would say is there's 2 parts of us there, at least, but let's keep it simple. There's the part that got hurt and didn't get to have his or her emotions. And then there's the part called the protector. This is the exile. This is the protector. The exile got hurt. The exile got exiled from the system because the protector said, whoa, if you have that emotion, you're going to overwhelm the system. So I'm not going to let you have that. I'll give you burning tongue. I'll give you back pain. I'll give you whatever. Okay. Whatever this, I'll turn on your autoimmune, whatever it is, because that protector is also 3 or 5 years old and honestly believes that they are saving us.
Wow.
So in internal family systems, we'll split that apart and we have to deal with the protector first. Because if you bypass the protector and go right to the exile, you're going to piss off the protector. And this is stuff, Dick Schwartz spent 40 years getting people on board with this. 8 years ago, he couldn't fill a classroom. Now he doesn't have enough teachers for the number of
he's hanging out with Dr. Schrubener even.
Oh, he is.
You're saying the COVID stuff, these people who are reacting, and it's terrible. I have enormous empathy, but this work can help anyone with long COVID or anyone with reactions to this particular vaccine or not. You're saying these people are TMSers.
Let's be careful with that. Yeah. Let's be a little careful with that because we don't have enough long COVID or data, particularly in the TMS world, to support that all long COVID is TMS. But what I will say about it is 2 things. From a TMS perspective, I am going to get a symptom that's believable, right? If I think, no, I have a herniated disc here, where's my pain going to be? Because that is believable to me, right? So that is 1 point in favor of TMS. And the other thing is there is always emotion when there is illness. Whether let's say you break your leg. Okay, clearly you fell and broke your leg, right? That is trauma, right? There's nothing emotional about that, right? You fell and broke your leg. But what happens after you break your leg? You have pain. You have immobility. Maybe you can't go to work. Maybe you can't carry your newborn baby around. All of that stuff compounds and stresses us. As we know, if I have a little bit of pain and I get like this because something happened, it hurts more, right? So there's always some emotional piece, even if there's a physical piece.
This is why the research that we talk about the veterans that would get injured and the ones that knew they were going home didn't have a lot of pain.
Exactly.
Wow.
And think about that. That's a powerful, I don't have time for my emotions now. I'm in survival mode. And when you're in fight or flight, this is offline and your limbic system's offline. The only thing important is survival. And if it's the 5-year-old planning the survival techniques, right? I would plan survival a little differently than I was when I was 5 today, right?
So this is a beautiful segue into talking about our title, which I really think we could talk for weeks and weeks and weeks about whether pain is your friend or your foe.
I would call pain my friend. It's a foe to the part of me that doesn't want to be in pain. Pain sucks, right? And for someone who's had a lot of pain, our brain, when you have chronic pain, we both know that our brain lights up differently. It's more emotional centers lighting up. Whereas someone who doesn't have chronic pain, when they have pain, it's much different for them. So we happen to be more sensitive to it, right? So that part is, I'm not for at all. Friend, though, if I fall and break my leg, the pain is saying, don't move your leg, dude. You'll do more damage. Wait till someone gets here that can splint it for you, right? And then once it's splinted, what happens to the pain? It drops down. It happens all the time. I saw it as a ski patroller. I saw it as a paramedic. When we splint something that's injured, the pain drops because they're not spasming anymore to protect it because the splint is holding it, right?
Yeah, I mean, we're keeping it, we're stopping the movement.
Yeah, so now I don't need to spasm all those muscles to protect the bone. The physical splint I put on is protecting it, and I can relax. And the pain drops because some of the pain is due to the injury and some of the pain is due to the spasm. So that's where our, the other thing is pain is my friend because it's telling me something's not right. The challenge is in Western medicine, for the most part, if there's pain, get rid of the pain. If there's pain, fix what's broken. And the problem is we miss, and Dr. David Hanscom will show you the results of 80% of back surgeries fail. Why? We operated on the wrong thing. It wasn't the herniated disc. It wasn't the bone. And he'll tell you, there's 20% of those people out there, he can do surgery and help them. But 80%, it's not a surgical issue. It's an emotional issue where we have to go back and do that work. So the pain is telling me that. The pain is helping me recognize. The challenge is our world is about, if I have pain, take a pill or get a surgery for it and go home. And that's not always the case. We're probably reversed there. We need surgery 20% of the time, not 80% of the time, particularly in back injury. Or back, I should say.
So I think pain is always your friend. It's always a message. It's always a message.
Yeah. And it may be a message that you're really hurt, right? It may be a message
you need the pain. You need it to tell you, but to learn to respond, as opposed to reacting, even in acute situations will be better for you, especially in chronic situations.
And think about that respond versus react too. Let's talk about that because that's a really important topic. And that is, you're familiar with Viktor Frankl. We both love him. Between stimulus and response, there's a space. And the space is our power to choose our response. In our choices, our growth, and our freedom. But 80 or 90, I think it's 90% of the day, we go to the subconscious and we go from stimulus to response. We don't even think about it. It's only 10% of the day we actually go, how do I want to behave? The more we open up our container size when I'm feeling pain, and instead of going, oh, I got to take a pill, or oh, I got to call the doctor, what's this pain telling me? Now, if I'm having chest pain, I think it would probably be best to call an ambulance, go to the hospital first, and figure out if it's TMS second, right?
Right.
But that window, that container size, that I think Dr. Gabor-Mate calls it window of tolerance. How can I hold on to that so I can get in here and make a decision? Oh, I'm having chest pain. Better call 911. Oh, I'm having that wrist pain again. What's going on there? Before I run for the ice pack or run to CVS and get a splint for it.
Mm-hmm. Well, and that's always rather than, why is this hurting? Rose always taught me, I'm curious what's going on.
Yeah. Can I be curious about this pain? Yeah. But
Yeah.
again, window of tolerance. How long can I maintain feeling that pain? You know, the pain is trying its best to give me a message. If I've broken my leg, the message is don't move your leg. If I've got a herniated disc, it's probably part of me going, don't think about that issue that you had when you were 3 years old.
Or, you know, I learned a lot in chiropractic school about, we used to say that we had a pharmacy inside of us, which is true. We can create opioids, we create heroin, we create cannabis. When I exercise, I create endorphins. So, but what I've learned further in the years is through my exhale, even a deeper exhale that activates the diaphragm, which connects to the vagus nerve, I'm creating an enormous, like, medicine cabinet.
Yeah, you're
Just
creating a
by,
parasympathetic response that is the drug in our body that is designed to slow and calm. That's what it's made. That's what it's there for.
talk more about that.
Well, we have a parasympathetic and we have a sympathetic system. The sympathetic is strength, is if we get a sympathetic flow into our body, we're going to be more tense. Our blood pressure comes up, our heart rate goes up. Okay, that's designed to constrict our vessels, bring our blood pressure up, prepare us for fight or flight. That's the sympathetic side. And then there's the parasympathetic side, which is the calming, the cooling, the slowing down. If you take a deep breath, hold it for a second and let it out deep and take your pulse, you'll typically notice a little pause when you exhale. That's the parasympathetic, slowing your heart. That's one of the reasons deep, slow breathing helps us calm down. One, it gives us a focal point. And two, it allows our body to naturally, the pharmacy you talked about, produce the chemicals that we need in our body to slow things, to relax things, to take the edge off. And that also is directly related to fight-flight. Now, our fight-flight mechanism, as we all know, is millions of years old. It predates humans. And it's designed to save our life. See snake, run. See tiger, jump. Whatever you need to do. I think, how did Peter Levine say it? See tiger, run. See snake, jump. Right.
Yeah.
And in that moment, that's saving our lives. Ancestral man used that 3, 4, 5, 10 times a day, whatever, and he used it and then he let it go. If you look at Peter Levine's videos on this, he shows where they with an animal how they shake it off. Yeah. Humans aren't good at that. We forget to do that. So then we hold on to all this fight or flight. Well, fight or flight is designed to save our lives. So again, our brain's going offline, our limbic system's going offline, and we're only in survival mode.
Wow.
So if we can recognize that and take those breaths and go, how often we say, particularly PRT, right? We talk about safety, right? Pain reprocessing therapy talks all about rewording, rewiring your brain, right? I am safe. Well, am I safe? Well, if I'm terrified right now, and then I can hold on to that for a second and go, wait a minute. I'm in my house. It's 3:00 in the afternoon. I haven't heard anything. There's nobody banging on my door. Well, maybe it was a thought that made me feel unsafe, but I still go into fight or flight. 95% of the time, I think we use fight or flight.
Wow.
It's because of a thought or something we saw, and now we're not managing our emotions anymore. We are in fight or flight. Yeah. And that can be sympathetic or parasympathetic.
Right. And then it's happening automatically, and we think we're not in control, but we are. I want people to know there is an absolute way out. And you can control your thoughts by responding, by breathing, by watching, by witnessing, by observing, by not reacting. And I call it like the ultimate form of control is a letting go, because that's real control. It's it's like an opposite, or what Gordon will call counterintuitive. Look, pain does, you said it, suck. And I'm saying pain is, is usually something is wrong, but not in this way. And chronic pain or plastic pain, medically unexplained symptoms, majority of things that people are feeling is counterintuitive. It's coming from the brain, which is fascinating when you try to explain to people that all pain is in the brain. I mean, it's fascinating to have that discussion.
But let's step back even another notch, because a lot of people still use that word, the brain, which was coined by Dr. Sarno. And I don't personally like it. And I'll tell you why. Because my brain is actually, there's lots of parts of me. From an IFS perspective, we're multi-personality, and this is normal. I know that just triggered a bunch of people who listen to that, but listen to Dick Schwartz's stuff and he'll explain it a little better. So it's really, let me back up even a little bit. In the heart-centered hypnotherapy world, if I'm doing a session with somebody and they go into shock, they go into fight or flight, I do things to get them back into their body so they can process the emotions we're working on. The way Dr. Schwartz looks at it in an internal family systems perspective is the shock was turned on by a protector on purpose to get you out of the scenario. So what he'll do is he'll address the protector directly, which is a part of me. Why did you do that? What's going on for you? How can I help you?
Wow.
Yeah. So exactly what you said is we indeed do have the power. We have actually created all this. But who's in charge in the moment? The 5-year-old or my strong, wise adult? Or maybe a little of each.
Yeah. Yeah.
So
and then so it's about trusting. It's about trusting. Okay, like whoever's in charge, whoever's controlling, it's about trusting. And that's what, trusting this process and just, riding this wave. And we're back to loving your body, and we're back to pain is your friend. Pain is a message. Pain is an opportunity. I mean, a few weeks ago, I had an amazing chiropractor who actually went to work. He spent some days with Strubiner. I just love when my world of people I don't even know ends up meeting. And a lovely, lovely, lovely man in Arizona. And he wrote a book called Pain is Your Superpower. And I was so attracted to that because a lot of, Dr. Clark will talk about, Dr. Clark's big thing is, of course, being a butterfly on the wall of your childhood. But he'll converse a lot with Becca Kennedy, Dr. Kennedy, who was, and I think it was her, someone's son was talking about like just teaching people, because we grow up and we think fear, pain, bad, negative, nocebo, this is it. It's black and white, like as opposed to opportunity. Pain is a message. How can I learn?
Well, what was my learning as a child with pain? So the typical parent, when a child falls down and they skin their knee and they're crying, the typical parent is, oh, don't cry, honey. It's okay. I'll take care of you. Well, why would he not cry? He's in pain.
Right.
It's okay to cry. How about, oh, I see you're in pain there, honey. What can I do for you? Maybe you need a hug. Maybe you need a Band-Aid. Now understand, I did not do this well as a parent, okay? You can ask my kids, they'll tell you. Ask my ex-wife, she'll tell you. Because that's a very important point too, is to remember that we are imperfect children raised by imperfect parents in an imperfect world. And that's a heart-centered perspective. And the bottom line is, when we were parents, I was 25 when one child was born and 37 when the other. And that's not a lot of life experience to raise children. And we typically don't live in communities like we do in some countries. I think Israel's a little better with their communities, and some of the indigenous species are better with their communities.
Yeah.
The United States, we are crappy with that. So we don't have all that. And the parent is just going on whatever they think is best, because they don't have a community supporting what their needs are. So as parents, sometimes we don't do such great stuff, right?
There's the word called forgiveness.
I learned that one from Louise Hay. She was huge on forgiveness. It's very hard to do, but it is so powerful when you can do it.
Yeah, it's chemical.
Yeah.
I just want to say to the listeners, and anybody who wants this document, I made up partly from my work with Sarno, but I added, so I always say, like, you need the knowledge, you need journaling. The journaling for a lot of people works. By the way, Dr. Hanscom, if he doesn't journal every day, he gets neuropathy in his feet. So, meditation and mindfulness, which is, a challenge for all of us. 4, this is the things that Dr. Sarno would say. Number 4, to get back to exercise, let the brain know that there's nothing wrong with you. And number 5, one of Sarno's would be to believe 100% that it's psychological. We don't need to 100% believe it, but to understand the psychological piece is part of the healing journey. So what I added, 6 and 7, which are self-compassion, which is enormous chemical reaction, and then forgiveness and gratitude, which are so important in changing your relationship with your body. Because I have met people who have healed everything from cancer to MS, which my own mother died a terrible death from, to every kind of chronic pain, to every kind of symptom. And what they did, Matthew, was they had to love their body, and they had to love even the part of their body they hated. And I say that with such love for people that are struggling. So this is, if anybody wants this, is a sort of a little report. I send out this document to help people, because I say, if you follow these 7 things, if you develop these habits of journaling, mindfulness, believing psychologically, having some gratitude, forgiving, you'll be able to change the habit, walk a new pathway, build a new circuit. Anyway, I'm so happy to invite, I love your name, Finulia, but I call her Finn, but can you pronounce the name?
I would have to ask he or she what it is.
Anyway, this is this magnificent, beautiful woman who lives in Ireland.
Okay.
Who I have had the pleasure of meeting. So I'm glad you joined us, Fionella. Fionella, it's a beautiful name. Joe Dispenza says that the traumatized body has become the mind. And if we are slaves to the body, we are stuck in the past. That to move forward, we need to create from our minds and body, and the body will not give up without a fight to that new creation. So the question that she's asking is, how is pain our friend if it tries to keep us stuck in the past fear?
That's a great, awesome question. And I'll answer it from the perspective of internal family systems, which is the pain is being created by a young child, okay, a 3-year-old, a 5-year-old. And they honestly believe, when we talk to them, when we get to them and chat with them, we find that they honestly believe, first of all, they were forced into this role. This was not their choice. They were forced into this role, and they are doing it to protect the system. And once we can get to that part and talk with that part and go back again to your trust and safety with the strong, wise adult, or the self energy, which that part doesn't probably believe even exists at this point, okay, then we can help them heal. So that's why the pain is a friend, in that the pain is really waving a flag going, whoa, help me, help me, help me. And that part, when we get to those parts, particularly protectors, when we get to them and we talk to them, we'll find they don't want to create pain. They don't enjoy it. And they'd actually rather have a different role. So what Joe Dispenza is saying is exactly the same thing I'm saying. We're just using different words on how that happened. Okay. And I imagine if Joe Dispenza and Dick Schwartz had a chat, they'd be on the same page. Again, we're just using different words. So the key is, if we can befriend the pain, if I hate the pain or I yell at the pain, that's just going to make it more angry and more scared. If I can love it and be compassionate, it goes, oh, there's someone who will keep me safe. Wow. Yes, exactly what you said. Your protector thinks it's unsafe to talk. And when you can chat with that protector and find out why she feels it's unsafe, the other question I would ask that protector is, how old are you? And then when you find out how old she is, ask her if she knows how old you are. And I will bet you, it's very frequent, they don't know. And when they find out that you're a wise adult, and now they have an adult to look to, which they believe they didn't, whether they did or not, the world changes very quickly. Because again, we go back to attachment theory, right? Now I feel loved and cared for, and I feel safe.
Wow.
Yeah, I would, how is it pronounced? Fiona?
Yeah, it's a beautiful name.
I would highly recommend if you Google Introduction to Internal Family Systems, you'll find an 8-minute video by Dick Schwartz. Listen to that. If that interests you, if it resonates with you, grab one of his books. He's just
or you know, this sensation is so strong and it's not stopping. So, for example, what does one do? They could have the whole intellect, and this happens to be a very intelligent woman. But if someone's pain is so strong, and we know it's neuroplastic, what does one do in order to read the book and relax and get,
well, that goes back. You and I had this discussion
Right.
before, and that is when your pain is so severe, sometimes the key is getting the pain down to a level of comfort where you can then do the work.
And
that may require medication, or
Yeah.
another thing is one of the biggest, I shouldn't say biggest, one of the things that makes TMS hard to work on is we think we can figure it out ourselves. We think we got it. I don't need any help. Don't come to me. I got it figured out. I know what's going on. I don't need you. And when I stay in that world, I am not curious. I am not open to what Tova Goldfein could possibly see, because I can only see me through my lens, my eyes. Mm-hmm. Yet you see me through a different lens, and you might go, Matthew, did you realize you were talking about your mother and those pictures that, you know, your mom passed a couple years ago, and you're talking about those pictures that she left that you have to distribute to your family, and then all of a sudden you started feeling poorly or your back started to hurt? And I go, you know, I completely missed that because my protector doesn't want me to. Then you saw it and you gently said, Matthew, could I share this with you? And then you share it and I go, oh my goodness, that's right. That's part of me that's terrified or scared or still grieving my mother, whatever. And then that you help me open up to another opportunity by helping me be curious.
Yeah, and they're listen, it's hard not to be just so pissed at that pain or so fearful it won't go away. And that's like, you could be like, no, I'm dealing with my fear, but inside you're like freaking out. So I think it's a knowing yourself and understanding your relationship with this pain, which is friend or foe. But I also, tell me what you think about this. I think I heard this somewhere, and I could research it, but isn't it true that if I'm not focusing on that pain and I'm focusing on my breath or something else or my children, or that you won't feel it? Isn't that science?
I see that happen with myself. If I go dancing, I'm an avid dancer and an avid alpine skier. And when I do those two activities, everything else is gone.
But isn't it true that the brain, if it's focused on what you're used to and where you're feeling sensations, that if you could learn the focus with meditation or mindfulness or just simply practice energy.
Exactly what Nishani just said.
Yeah. And so I believe this is science that might be something that Dr. Schubiner talks about with, what's this word? It begins with a C. It begins with an S. It's the focus. My brain can only focus on one thing at a time. it's because it's like when you're looking at that picture with two faces, and I keep
Yes.
thinking, I have the book right here. And he talked about that the brain can only focus on one thing at a time. And if you choose, it chooses what to focus on. The word is called, it begins with an S. I can look it up. But anyway, I think this is science. This is
yes. And the challenge is, though, and it depends on the person. You know, I sometimes see a client and all they really need to do right in this moment is work on calming down. Let's not even talk about inner children until they can get their nervous system somewhat regulated. Like my story of needing to be on a fentanyl patch so that I could go. And again, I'm not recommending that at all. I'm very lucky I didn't have a problem with that. That now I can go do the real work. Now I can go see my counselor. Now I can get to the root cause.
Yeah.
Yeah.
Wow. Thank you, Nishana. What a beautiful name, Nishana. Nishani. Energy follows thought. This is like, you know, and us TMSers, we are strong, stubborn, powerful, focused. And I would say shift that focus to serve you.
And I think a lot of that also comes from our childhood experiences where we didn't feel, regardless what reality was. As Dr. Peter Levine says, trauma is in the eyes of the child who perceives it. If my perception is my parents are not there for me, I will decide I don't need them. Well, we all need our parents. We all need help. We all need the village, but we believe we don't. And that, again, fits right in with Sarno's list of the type T personality, right? Yeah. And to answer Fionella's question, could I practice not being frightened on my own? Absolutely. I'm not saying everybody needs a coach or a counselor. It's just very helpful. And then again, that goes back to Alan Gordon's work with, and not just his, but the PRT is very big on this. And that is, if I'm not feeling safe, well, check reality, folks. Am I safe? Well, I happen to be safe right now. I might not be feeling safe, but I am physically safe. So now what's the true issue? I am back to a time in my life, whenever it was, when I wasn't safe. That's what I'm reacting to.
Yeah.
And then I can say, no, I hear you. We are safe. What can I do to help you? You know, does that younger part of me need a hug? Maybe he just needs to be listened to.
Yeah. And that's where, you know, I might be saying, well, let's dial it down. Let's dial it down to 10 and to 9 and 8. And that's not going to happen because the little, you know, like, and this is where it's so interesting to talk about, because it could be it could be not a child. What I mean is lots of the symptoms people are having are from recent things, or like the COVID vaccine or something, or, you know, getting off medication, or different things that are happening to people that are not typical. Well, I had a trauma in childhood. I had a, you know, childhood adverse experience. It's more like, but what I think you're saying is that the reaction that some of us are having as an adult is because of patterns from a child.
Yes. So that is exactly the point. Is it's not the COVID vaccine. It's some other fear that's the thing that's believable right in front of me. The herniated disc. Oh, that's believable. That's where I'll have my pain. Oh, COVID vaccine. I'm afraid of that for whatever reason. You know, there was controversy both in ways with it. And honestly, anytime you put a drug into your body, I would want to know how it's been tested and what the risks are, right? That's normal. But then our younger parts will blow that out of proportion, probably as a distraction from something else that's going on.
Yeah.
And to answer Fionella's question, yes, you can absolutely practice speaking more on your own. That's a thing that I had because my mother was always, shh, no, don't talk about that. Don't talk about that. We can't let the neighbors know. You know, that was a part of how I was trained, because that's how my mother was, and many of us. You know, don't tell anybody about that. No, we don't have dirty laundry. We all have dirty laundry.
Right.
So yes, you can absolutely practice that. It would even be better if you could practice it with someone, with a friend, whatever, where you can. There's a technique called exposure therapy, where you expose that person to what's going to trigger them a little bit at a time so they can start to feel the sensation, but in a small way. I'll give you an example. I was working with a client. She's a fellow coach, actually, and she's working with an issue with fear of dogs. And we were walking in the park, and there were dogs. And I said, I got an idea. Let's walk a little faster, get a little closer to the dog and see how you're feeling. And as we got a little closer to the dog, she started to get a sensation in her chest. I said, can you tolerate that? She said, yes. And then we went from there. If she couldn't tolerate it, we could have just backed up a little bit. And you move into that. We were talking about container size, window of tolerance. Feeling that sensation. What's coming up for me when I can't speak for myself? Because then that will take you to that younger part that has a belief system that she cannot speak for herself, which, by the way, is a super common issue, not wanting to speak up.
And exposure therapy is where PRT came from. So the PRT is being comfortable with your symptom and not seeing it through a lens of safety.
Yes.
And understanding that there's no threat. It's just a perceived threat. And so how do we bring safety and love and compassion and trust, to that symptom? It's fascinating. I really wish there was just one. I mean, like the whole Dick Schwartz thing. I wish there was just one. They're all so fascinating. And for everyone who's listening, find your way and make a combination, make a recipe of a shake of many different things, and use this and use this and use this. Like I had a woman who's like, journaling changed my life, but I can't even think about meditation. I'm like, whoa. I'm thinking, but this is maybe why she still has her symptoms, because but it's not for me to decide. Like for some people, journaling is not going to work. And what you're saying is, if it's not going to work, if I say it's not going to work, then it's not going to work. That's how powerful our thoughts are, because energy follows thoughts.
Yeah, if you say it's not going to work, I believe you. But then again, that goes back to what Dr. Evans taught me, which was try lots of things. And we are so lucky today to have so many great practitioners out there, so many great processes. You can see a practitioner, you can read a book, you can get on a website, whatever. Try them all, and then take from each the pieces that resonate with you and build your, like, I don't use journaling regularly, but when I want it and I need it, it's the best thing in the world at that moment.
Yeah.
Wow.
I cannot believe it's an hour. I mean, like, if anyone out there wants to share, I mean, Matthew is just like, you are such an expert. I really, we may need to have a monthly coffee clutch, because I'm
open.
And I don't think I interrupted so much tonight. I think we flowed. So I hope my
I think we did good, because we're both interrupted.
Won't come at me, because I do sometimes interrupt, because I'm excited or anxious, because I'm human. I had a mother who didn't even have a thermometer in the house, so she never cared about me, like whatever the reason is, I am who I am. And I love that my listeners forgive me for interrupting, but what a flow, what an hour of just, you have such a hold on this. I really just, and you stay with it. You're focused, you get to where you come, you go a little bit here, and then you come back. You're an amazing communicator. You are an absolute expert. I'm just in awe to be in the same profession as you, and to be learning from you, and to be humbled by your intelligence. And I have not had sciatica and back pain. So really, we both talked about our IBS symptoms together, because we're both pretty resilient when it comes to our bellies. But in the meantime, none of us are immune. Whether my trauma, your trauma, my emotional, like we're here because, like Michael Galinsky says, we have this disease called being human.
Yes, that's a beautiful way to put it. We're all going through this. One day we'll all realize we're all going through it, and we will be so much more compassionate with each other. And I just saw Rosanna mention the ADHD word. Thank you.
Yeah, but she's promoting something else. What is she promoting?
Oh, she's selling something. That's too bad.
Yeah. Anyway,
Because the ADHD, I happen to be ADHD, and it
who is not? Who is not? Raise your hand.
there's
Who
a
is not
comorbidity, interestingly, between that and TMS.
First of all, who's
Yeah,
not?
we all had a little of it.
I mean, who's not traumatized? And trauma is not a bad thing. Let's give trauma a little bit front and center. First of all, trauma, and I like the way some people call it. What's your definition of trauma? But what I like is it's your experience of the trauma that we're healing. The trauma's done. So how would you frame trauma to help all of us?
Gabor Mate has a great definition for it, and I can't think of it right now, but he says it's not what happened to you. I believe it's more about what you feel about it and how you're processing it.
Yeah.
So it's not the physical act of the trauma, it's the how we're processing it and how we feel about it and how we're going to work with it.
Well, I think that's where I learned that from. It's about our experience. Like stress is stress. It's really our relationship with, and even Dispenza, he'll just say trauma is a memory. It's done. Come to the present,
Right. So again, that key that you said, the relationship to it. And sometimes we've talked about diagnoses. Sometimes people get hung up in the word ADHD or TMS or bipolar, or pick one, I don't care. And we get hung up in the diagnosis, and the diagnoses are convenient so we know what we're dealing with, but they can become a crutch when we go, I have this and therefore I'm broken. No, to me, the ADHD I have lots of superpowers with that, but I also have things that I don't do well. But knowing that, I can choose to use my superpowers instead of the things I'm not good at, and get other people to do the stuff I'm not good at.
Yeah.
Yeah, that's what we used to do when we lived in community.
Yeah.
You weren't expected to do what you weren't good at. You were expected to do what you are good at.
Yeah.
Because that's what makes community work. That's what makes this village survive.
Yeah.
Right?
Can we talk a little bit about like ADHD, like it's not a label. It's not a sentence. It's actually people are sensitive and strong. It's like actually a quality that can serve you. It's a superpower. If
you understand it. Now understand, my symptoms started when I was 10 or 12. I never knew what it was. I just knew I was different from other people. And I survived in the world fairly well. I've done very well. I was a paramedic, great job as someone with ADHD. I did computer programming and critical level, tier 3 level support. Great. When the shit hits the fan, I'm the guy to call. But what I really learned, and Gemma McFall, who I believe you know Gemma.
Yeah, she's amazing.
One of the things she taught me was she works with what's called Clifton Strengths. She's all about what are your strengths. And I have my clients, for the most part, take a strengths inventory. What are your strengths? Let's work with our strengths. And once I understood the diagnosis and did some research, I was like, oh, wow. Now that I understand this, now I know how I can work with the body, the brain that I have to succeed at what I want.
Yeah.
And that might mean hiring you to do something I'm really crappy at.
Yeah.
Right?
Yeah. And knowing your strengths and not weaknesses, but channeling.
Yes.
Channeling, your creativity. And anyway, amazing. I'm really thrilled that people came to talk with us. If anyone wants to speak to Matthew, he's on Facebook. His Facebook page is Tension Myositis Syndrome. It's got it. Yeah. And it's and Matthew is available to answer questions there. And sometimes I'll answer a question there or so. And Matthew is also, you're doing virtual therapy?
Yeah, I do virtual sessions. I'm mostly retired, but I still see people because I enjoy this. I like helping people. And I've got a breadth of knowledge that I have collected over years that I want to share, because there were so many people that did that for me.
Wow.
We were going to mention the TMS Wiki. We didn't get to it. But me and Rob, who created the TMS Wiki, met in like 2009. He created it. He was one of the first to actually put some group out there that people could gather and go, oh, we're all sharing this
So
stuff.
wait, you with Rob Munger?
He created it. I met him in 2009, and he and I actually did a Sarno panel together in 2009 on this thing called Dim Dim. It was like Zoom, but much more archaic. Yeah. And he and I have known each other for years. We've been doing it together. Yeah.
Yeah. Amazing. No, TMS Wiki is unbelievable. Unbelievable source. And yeah, I'm just, I could go on and on and on, but I'm tired, and but I'm just so pleased with my less interrupting. I think that's a name of something, like interrupting or something.
Well, you know why that worked? Because you and I talked about it before we started, and we understood each other's tendencies, and then we had space for each other.
Yeah.
To be more cautious. So we had a good conversation.
No, I was very also relaxed. Sometimes I'm not relaxed. I'm a little nervous with the guest. I'm not sure about the topic. I mean, you know, like Dr. Hanscom and I are the closest friends. We email probably every other day.
Okay.
You know, but like I said to him, like, I'm just, he gets out there like intellectually, and he loses me, you know, like on the show. And I realized that sometimes it just has to, it may not match so well. You know, but anyway, I'm thrilled to be in this place, and I'm thrilled to, with all my ADD, to come on here every week and do my magic and meet people. And I'm always looking for people who have stories. I love to, and guess what? When people, you don't have to be healed or in recovery to be on this show, because being in this studio is enormously therapeutic.
Yeah.
So
I don't call myself cured.
Yeah,
I still get some aches and pains. I actually had some symptoms of the sciatica popping up and down in the last few weeks, and I've noticed it and worked with it and realized where it's coming from. I just dropped into the host chat the link for the tension myositis Facebook page.
Where is, I don't know how you do that. Can you do that? Because
I clicked on host chat versus public. It doesn't look like I can post.
Oh yeah, wonderful. So I'm gonna, let me just see if I can cut and paste it. If I can cut and paste it here. So let me just go to the name of it. It's called tension
myositis syndrome.
Myositis syndrome. Kim, you can also message me and I'll send it to you. It's a nice interactive. It's a little bit like the tension, the mind-body syndrome.
Yeah, we're a little mellower, and we're a little more open to not just Dr. Sarno's work, but to other, because Dr. Sarno went to a limit and then retired, and now people like Dr. Schubner and Dr. Clark and Dr. Schechter and Dr. Hanscom and Dr. Mate are all continuing that work. And we've learned some of Dr. Sarno's stuff is not useful today, and a lot of it still is. And we keep learning and evolving and growing. And we're a little more open on my group about what's right and what's not right.
Wonderful. Well, I say this every time, but I really am going to invite you back.
Okay.
Let's meet again. I think there's a lot to talk about, and I really love dialoguing with you. And I'm so happy that people came to visit, and blessings. I really, really am thrilled to end this hour with you. So have a wonderful afternoon.
Thank you so much for having me.
Remember this face. We will meet again.
This face.
Okay. Don't go. We're off.